ISC is really to bring all of those resources together in one place and help people navigate what can be a very complicated system.
This program, it's a little different in that you're not only a nurse practitioner, you're also able to work with and coordinate all of the different disciplines.
Exactly. So, when people come to us at CPC Behavioral Healthcare to start getting some of their mental health, behavioral health, addiction services, all those needs met, there's often all these other parts of their care that maybe they haven't had the resources to address yet. And so it's really great to be able to, provide the services that they came to us for, but then also meet all these other needs and help them navigate, is there a specialist that they need to see? Do they have a primary care provider? Do they need lab work? Do they know, what specialist is covered by their insurance?
And you've had some success with a particular patient, and we'll call him Derek to protect his privacy. Can you share a little bit about this particular person?
Absolutely. So Derek's a great example of how this program can really benefit people. He came to us with a lot of other things that needed to be addressed. And so while kind of doing that stopgap and providing some primary care services and helping him get on track with his physical health, one example is we found a thyroid condition that had been undetected, and he's really taken on a lot of new health goals. He's really changed his diet and exercise, which we've been able to help him at every visit along the way. He's been able to work on quitting smoking. He's had regular follow-up with all of his specialists that he needs on board. So he's also, preventing a lot of the long-term health damage that could come from not addressing these things at a younger age.
Thank you so much for taking the time to talk to us, Julie. Really good. Well, as Julie just mentioned, one of her patients, his name is Derek, who's actually joining us now. Derek, thank you so much for taking the time to talk to us.
No, I appreciate you reaching out and look forward to helping people out in the future.
Right, and can you tell us a little bit about how you and Julie found each other and got in touch and began working together?
It's actually been a match made in heaven. Julie and I linked up post-treatment. She was part of my post-treatment recovery plan. She kind of handled the medical aspect of it as well as the mental health aspect.
What we're talking about, what you're having to deal with, is an addiction, and it came about because you hurt your arm, cancer in your arm, and a doctor handed you a prescription, and it took a turn.
It was a prescription given to me, perfectly legal, but it started a freight train rolling down a hill. And then before you know it, you're completely dependent upon it, and your entire life is revolving around a substance. When I went to see Julie was the fact that they kind of, CPC itself really looks at not just the mental health aspect, but they link up with your doctors and actually take care of the medical aspect.
How do you feel about the future? I understand you're over 500 days sober.
I think it's extremely important for people to hear it from someone who's, look, am I a success story? No, I'm just 500 days clean, Every single day is a battle. Some days are easier than others. Nobody can tell you, nobody can do it. You have to be able to do and find what works for you. I was lucky to find Julie and CPC, and their program has worked for me. Obviously, the 3 previous times before, it didn't work for me.